Okay. If anyone knows me, like for any amount of time, you'll realize I am a big fan of physical exertion, and to my own detriment. I'm like a Clydesdale horse. I like to work for work's sake. There's not even a purpose to it. I like just stressing myself, like physically. But with that, in my earlier years especially, I acquired a lot of overuse injuries and then would just push through them to the point that like I just have like a left knee that's got a little thing going on to it, and I gotta like be cautious of my progressive overload sequence. My low back, which wasn't my fault, but that happened. I had a plantar fascia thing, a slap tear thing, the tendon thing here, a bunch of stuff. But for the most part, they're all managed and like they don't really rear their ugly head too often. But my plantar fascia, and anyone who's had plantar fasciitis, if you've had it yourself, or if you're a clinician and you work with it, it's like one of my favorite pathologies to work with. I think probably because it's just personal to me. But it is very much a pathology that if you start physical therapy, or if you read, like in research, we got research articles that compile a bunch of research articles to try to be like the end all be all stance at the moment on a subject. And so if you read like a meta-analysis or systematic review on plantar fasciitis currently, it basically states that that's a 6-9 month rehab process, and no amount of like surgery or corticosteroid shots or anything speed that up. You have to learn to load that tendon, and very often they are at a point when someone starts physical therapy that the amount you can load it is like really small. And so it's like a big journey to building it back up to just doing whatever you want. Now, anyone who knows me or any patient I've had has been probably berated by the fact that I love spring black bear backpack hunting. Going into the mountains, climbing elevation, looking for black bears. And that's a lot of climbing, and that's a lot of elevation gain. And plantar fascias don't appreciate that. And so it's kind of like I got a pathology that also like hates the fact that I love backpack hunting in the mountains. And so I gotta like train for that. I gotta bolster it up. And the reality is, just like with low back pain, when you have a pathology, you have to kind of accept that it's going to take a lot of time sometimes to overcome it. And once you overcome it, it might still just be like a scar you carry with you your whole life, and you kind of gotta maintain it. Some people don't like that, and they think a shot or an anti-inflammatory pill will deal with it. And a lot of the times those people look up 5-8 years later and now are looking for a solution, and they're even in a worse hole than they started. But I'll tell you a little something. I did a vertical jump, which is just like a jump up in the air with one of the kids I was with earlier this week. And like later that night, I haven't noticed my plantar fascia much for like months. And I like felt my plantar fascia be a little warm. And I was like, man, I did one jump. And I noticed that, and I kind of think about it like I do a lot of calf raises, but I don't do any like jumping, right? And so my plantar fascia is not used to that like quick contraction and quick deceleration. So a part of my journey of living with my plantar fascia and overcoming it is I'm gonna start jumping again. And so I grabbed this band because like I weigh 220 pounds. So for me, jumping is not just something one does without like really pissing off a plantar fascia. So I'm gonna grab onto this band and I'm gonna jump with it, but it's gonna help absorb some of my weight and make my plantar fascia think I'm more like a 180 pound Austin than a 220 pound Austin. And then as it gets used to it, and I realize it's okay with it and it doesn't hate that, the band will get smaller and smaller until eventually I'm jumping on just my normal weight. And hopefully, come spring black bear season, my plantar fascia again is ready and up to the task like it was last year. And I can, continue doing what I love. So this is a part of my never-ending sequence of taking care of a body that is owned by someone who's neurotic enough to feel the need to just push themselves all the time.